For the next few minutes, I will be giving you a crash course on hemoglobin A1C tests. I know you've heard this term before because I know I mentioned it. So hemoglobin A1C is a blood test that shows what your average blood sugar level has been for the past 2 to 3 months. And doctors use this test for two reasons. One, to see whether a person has diabetes. And two, to see whether diabetes treatment is working the right way or not. So what should my numbers be, you might ask? And the answer to that is it really depends on why you have the test in the first place. Well, if you're checking whether you have diabetes, then this is what the literature says. So having a value less than 6 means you don't have diabetes. Having a value between 5.7 and 6.4, that means you are at a risk of getting diabetes, so also known as pre-diabetic. You should probably start doing things that can help prevent diabetes. Like you should become more active and lose weight if you are overweight. And if your value is 6.5 or higher, it probably means you have diabetes, but you should have the test done again to be sure. If you are checking the hemoglobin A1C to see how the treatment is working, well, if you already have diabetes, in that case, you want to have it probably below 7 or at 7. But you need to check with your doctor on what your level should be. Not everyone with diabetes is the same, and some people need to aim for different A1C levels than others. So the next question that you might have is, how often should I have this test? Well, that depends on whether you have diabetes and on what your last A1C test showed. So I'm going to present 4 scenarios so that you get a better idea of what I'm talking about. Scenario 1 is when A1C was done to check for diabetes and it was less than 5.7, meaning you do not have diabetes. In that case, you should have it done every 3 years. Scenario 2, you had the A1C test to check for diabetes and it was between 5.7 and 6.4, meaning you do not have diabetes but are at risk for it. You should have the test done every 1 to 2 years. Scenario 3, if you do have diabetes and your blood sugar is well controlled, you should have your A1C test every 6 months. And scenario 4, if you have diabetes and you recently changed treatment plans or you are having trouble controlling your blood sugar, you should have it done every 3 months. Well, all of this information that I'm giving you, it's part of the current literature, but do talk to your healthcare provider on how things are for you specifically. And lastly, you might want to know, why do these numbers really matter? So studies show that keeping your hemoglobin A1C numbers close to normal helps people from getting the feared complications of diabetes, such as kidney disease, nerve damage, diabetic retinopathy, which is eye disease that can cause blindness. And I'll talk more about that very soon. So yeah, there you have it. That's your hemoglobin A1C test in a nutshell.